This video will discuss some considerations when working with immigrants and refugees in a social work setting. The first that needs to be considered is the migration journey for immigrants and refugees. Along the way, they may have experienced trauma and other adverse experiences. If you think about pre-migration, so when they were in their original homeland, there's opportunities for trauma there. They left their home for a reason, even if it was for economic reasons, it could have been due to war. Depending on the reason that they left, it could have been related to trauma of some sort. So it could have been related to psychological trauma. They might have witnessed violence. They might have been exposed to war. They might have lost resources, lost their job, been in poverty. All of these could be traumatic or adverse experiences that affect the well-being of individuals when they reach their new home. Think about refugees or migrants who are fleeing their home. The process of leaving your home in and of itself can be traumatic. Leaving your home community, leaving your friends, your family, your belongings. For some of these individuals, they can't take everything with them. That can also be psychologically traumatic. The separation from individuals, if they're in refugee camps, there's high risk of sexual violence in refugee camps and in flight. So the physical process of movement can be experienced with negative mental health. Then if we think about the post-migration, resettling somewhere new, there's a lot of challenges that come along with resettling. If they're in a new home where they don't speak the language, there might be some racism associated with that. If they've lost their job, they don't have stable housing. There might be crime where they're living. Immigrants who are coming over, if they're low income, they're probably living in poverty in their new home. They might be in a high crime area. They might not be by people who have the same background as themselves. That can be really stressful for individuals. And all of these different stressors need to be taken into consideration to look at the whole picture of this individual when you're providing them with services. When individuals walk through your door, you're seeing them at one point in time, when you really need to be looking at, okay, across their lifetime, what other stressors have they experienced that could be contributing to the well-being, the mental health issues that they might be presenting with at this moment. There's a lot of barriers that are going to be affecting individuals when they're in their new home, when they've migrated. So now they're here, they're in their new home, and you're helping them at this point in time. There's additional things you should be taking into consideration. There's a lot of financial barriers. So a lot of people, when they migrate, they could be low income immigrants, or if they're refugees, that means they were fleeing their home and they probably aren't well off. They probably have low wage jobs in the United States or in their new community. And the other thing to keep in mind that, a lot of times for these individuals, especially if they don't speak the language, only the lowest paid, least desirable jobs are necessarily going to be available for them. So they might even have limitations in what jobs they can take on because of their immigrant status. The other thing to keep in mind is that degrees and work experience from other countries are not always honored in the United States. So there's been lots of situations where people had master's degrees or medical degrees from other countries. And when they came to the United States, medical degrees from other countries aren't necessarily honored. And they ended up in low wage jobs that only required a bachelor's, or that only required a high school diploma. So it can be really challenging when they went from being kind of high in the social status, making a good living for their family, to kind of starting back at zero when they've migrated. So that can be really hard on people's self-esteem, to have that big change, and to realize that they put so much education in and it doesn't matter anymore. There's a lot of cultural differences from living in the United States to living to where they were before, different work norms, communication patterns, home style differences. So, there's differences between what's expected of husband wife duties around the house, women caretaking duties are going to look different in different cultural groups. So that needs to be taken into consideration. Differences in diet, food differences, having availability of their traditional foods. So you really need to think about cultural differences. And you can, as we say in social work, you can't impose your values on other people. So you have to think about what are the values distinct to this culture, and how can you ensure that their values are going to be upheld in the process? There's obviously language barriers if individuals don't speak English and they're going somewhere that, really requires English to hold a job and to have higher paying jobs. And there's a variety of discriminatory practices within the United States that, there's a lot of discrimination against immigrants. We've heard a lot of negative rhetoric towards immigrants. Not everyone views immigrants as positive, despite the fact that there's an abundance of research showing the positive benefits of immigrants to culture and the economy of the United States. Not everyone necessarily views those as accurate. So sometimes people when immigrants come to the United States, they experience that discrimination. So we have to recognize, the current stressors that are impacting individuals' well-being when they come to the United States. So there's also going to be barriers that are really specific to just individuals accessing help. So if individuals who are immigrants and refugees are just trying to get mental health assistance, get connected with social services, there's additional barriers just to them getting help. Part of it is that they might be reluctant to even look for help because sometimes there's families, when they have the barriers that we were just discussing, they really want to prioritize their economic financial stability over other challenges. They're not necessarily going to prioritize mental health and academic grades or their kids' grades if they can't even pay their bills. So if you think about Maslow's hierarchy of needs, we have to make sure those lowest level needs are fulfilled before individuals can think of higher needs. So we have to make sure that, individuals have stable housing, employment, food, safety, that they feel safe where they are. Safety is a big one. So that all of those basic needs are taken care of before they're going to really be open to working on mental health challenges, which obviously are important, but those are going to come second to individuals when we think about those basic needs. They might just be not aware of what services are even available. So it's going to be important for social workers to really give them information about this is what you have access to. But they also might be reluctant to access those services. There's a large stigma associated with mental health. In most cultures, there's a stigma associated with receiving mental health care. They might distrust authority. If they had negative experiences interacting with mental health care services at home, it's going to make them reluctant to access those in the United States. The other thing is if mental illness is viewed differently in different cultures. So some different cultures have these alternative explanations for symptoms of mental illness. Some cultures, even in prior US American culture had viewed mental illness in more of a religious way, that this was a punishment from a mental illness is a punishment from a prior sin or sin of your parents. You're being harmed, you're being inflicted with mental illness as a result. So we need to take into account some of those cultural beliefs that might be underpinning their hesitation to receive help for mental health. So when we think about kind of overcoming these barriers to care, the top is understanding what their traditional beliefs are, what their cultural groups believe. So you can incorporate these cultural beliefs with the care that you're being provided. So it might be that you find a practitioner from a similar cultural group if you're able to, or have some other way of ensuring the family's culture is still being heard. So working with the family and their community members are going to be extremely important. You're not going to be able to do this on your own. You have to incorporate them, empower them to take control and get them involved. If the family doesn't have buy-in to the services that are being provided, they're not going to follow through. It's also going to be really important that you have someone you're working with who understands the culture and the language of the family. So we call these individuals cultural brokers. So cultural brokers are people who have knowledge, they're not just speaking the language, but they also understand the culture of the family. Because, if you think of, there's lots of languages that really are across multiple groups. Think about all of these different types of communities who all speak Spanish. Their culture is, there's probably 100 cultures who all speak Spanish. So just because I might speak Spanish doesn't mean I understand the culture of the family. So that's why it's really important that you have someone who understands both the language and the culture. A lot of insurance companies cover language translators. What's really important is that you're not using family members to be those translators, that it's really a professional who is going to serve as that translator, as that cultural broker, because you also need someone who understands the language with your specific service area. So if you're a healthcare provider or a mental health provider, there's a lot of complex terms that get thrown out a lot. So you need someone who understands those terms so well that they can properly translate them to the family. Especially think about these complex medical terms that we don't even know if the medical provider is speaking our language. We're having to constantly look up what those mean. That's why it's important that you have someone who's really has an understanding of both that service area and the language. And you shouldn't be using a child to be the translator, because think about what position you're putting the child in. Imagine if you're a school social worker and the child is in trouble at school for some behavioral challenges, and you have the child serve as the translator to the parents. They might not be telling the parents the full story. So you don't want to put a family member in the middle of it. You want someone unbiased, outside perspective who's able to serve as that translator. The other thing to take into consideration, if a family is reluctant to receive help for mental health care, if we can somehow embed our mental health services into the general service system, if mental health has a large stigma associated with it, rather than having to go to a counselor in a separate building to receive therapy, if we're able to have kind of a one-stop shop for receiving healthcare and other social services and mental health care all in the same area, it really removes the stigma attached to receiving these additional supports. So again, these are just all things that need to be taken into consideration when we are working with individuals who have an immigrant or refugee background.